So my Whoop now tells me what my biological age is, which is really cool and can be a little scary. But how about your teeth? Do you know how old your teeth actually are?
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on parts, the dumbest you've ever seen.
Generally speaking, everyone's teeth kind of come in the same time frame. And when we hit about 18, that's when we've got all the full set of 32 if you have wisdom teeth, or more realistically 28, even less if you have braces sometimes. But the difference is from that point on, as you age, how you treat your teeth, whether that's lifestyle, diet, how much you protect your teeth, how well you take care of your teeth. Unfortunately, genetics, how your teeth are built, passed down from your parents, all those things kind of play a different role in the biological aging of your teeth. And so in our practice, we have a range of patients from 3 months old all the way up to 99, probably a little bit older than that. And it's interesting because I can really tell the lifestyle of how people have treated their teeth over time and how it differs with how old they actually are. Very similar to how the Whoop is. If you're in your 30s and you have very flat, worn teeth, that's a sign that you've been clenching and grinding, and also could be a sign of your dietary habits have worn away that outer layer of enamel. The problem with that is the teeth are not designed to be so flat and worn at such a young age. So we have a lot of patients that are in that situation, or we see them going down that road, and we have to intervene, whether that's something as simple as a night guard. And what a night guard is, it's a small appliance that we put on the upper teeth. The advantage of a night guard is you do all your clenching and grinding against a plastic acrylic surface and not against your natural teeth. And we found something that really enhances and lengthens the lifespan of all those teeth. Another sign that your teeth are older than they should be for your actual biologic age is gum inflammation and lack of proper home care. A lot of times if you don't brush and floss and rinse and keep your mouth nice and clean, the teeth are going to start to break down at a much quicker rate than if they were cared for properly. So some signs of this are going to be bleeding gums, a lot of sensitivity, gum recession. If you're in your late 20s or early 30s and you feel like you have loose teeth, that's definitely a sign that you have something going on and is not the actual biological age of your teeth. Teeth shouldn't loosen up at any point, especially not by your 20s and 30s. And that's generally speaking a sign of periodontal disease, bone loss, an unhealthy mouth. And that doesn't mean that there's no hope, but it does mean that we need to intervene and come up with strategies to help you maintain those teeth and strengthen up those teeth. So what about yellow teeth or brown teeth? Typically speaking, staining in and of itself isn't a sign of unhealth, but it's also a sign that your teeth are not clean and they're not as healthy as they can be. A lot of times staining can be mostly from dietary factors or lifestyle factors, smoking, nicotine, coffee, tobacco. There are a lot of different things that stain the teeth. And if you have that kind of lifestyle, it's even more important that you're on top of your home care to make sure you're keeping those teeth nice and clean. Technology like the Whoop is great because it can tell you so many things. So whether it's consistent glucose monitors or carbon dioxide monitors, there's amazing things and amazing technological advances that are at our disposal. But please don't forget about your mouth. It's really important that you take really great care of your mouth, because if you neglect it, it will age quicker than the rest of your body. And the last thing you want to do when you get into the prime of your life, 60s, 70s, is start worrying about losing teeth, missing teeth, unhealthy teeth. I'd rather be able to focus on retirement, life, family. As a dentist, I want you to have a happy, healthy, fulfilled life. And my goal is to make sure that that's not impacted by an unhealthy mouth. So take care of your mouth so you can live a long and healthy life with a healthy mouth. I'm Dr. Brett Langston, owner at Dental Implant and Aesthetic Specialist here in Brookhaven, Georgia. And I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on parts, the dumbest you've ever seen.